Give a warm, rousing welcome to Jason Swartzwelder.
Thank you, Paul.
You're welcome, sir.
Good morning. I'm Jason Swartzwelder with Resource Benefits. Like Paul said, we provide the employee benefits for the group, which include health insurance, dental insurance, vision insurance, and worksite products. Our office has combined experience over 50 years, so we've been doing it a long time. We also do individual health insurance as well, but I'll talk about that in a minute. There's my boys. I'll show you. They're really into baseball. Both of them, I coached the little guy. The big one I've turned over now. He's on the travel team. I thought that was a cool picture. I blew it up real big in black and white. Something important about it, Resource Benefits. We are an independent agent. We represent all of the carriers. Aetna, AvMed, Blue Cross Blue Shield, Cigna, Coventry for the moment. Coventry was purchased by Aetna, and a lot of their plans are going to be going away. They're all going to become Aetna plans. So a little bit of change going on in the marketplace. Humana, Neighborhood, and United. United owns Neighborhood, but those are all the carriers that we service, and we can shop all those carriers and see what plans or benefits fit for each employee. Everybody's different. They're looking for different objectives that they want to meet and goals, and we can shop all these carriers to see what the best fit is for every company. I'm going to talk about a little bit something different today, a big topic, the Affordable Health Care Act, if you want to call it that. It was signed into law March 23rd, 2010, and upheld by the Supreme Court in 2012 in June. It's the largest U.S. healthcare legislation since Medicare and Medicaid have gone through. It impacts all Americans and basically expands access to care, supports enhanced quality of care is really what it did. It does not effectively address affordability, which was the #1 issue in America with health care. But why they call it the Affordable Health Care Act, I don't know, because it did nothing really to address that. It's really trying to get everybody access to coverage who doesn't have it. A lot of people, employers just don't offer it. And before that, last year, if you were unemployed and you wanted to get health insurance, you had to go the individual route. If you had diabetes, cancer, anything, a serious pre-existing condition, you could not get it. You would be denied. This year, starting in January, that has changed. So there's been a lot of changes. Some of those changes with the market-wide reforms are a guaranteed issue, guaranteed renewability. That's what I just talked about. If you have cancer this year, you want to get individual health insurance, they have to give it to you this year. They cannot turn you away. That's a good thing. No pre-existing condition limitations, no dollar lifetime maximums or annual dollar limits on the policies. They cannot cap that. Out-of-pocket maximums limited to $6,350 for an individual or $12,700 for a family. They limit $2,500 now to your flexible spending accounts, FSA contributions. Some other benefit changes is they've added clinical trials and mental health parity. Judy, you must like that part of it. But by taking away the no pre-existing, one of the things that's changed, I often talk about doing individual health insurance in here. As of yesterday, that was the last day an individual could sign up for individual health insurance for a May 1st effective date. So there's now enrollment periods. The open enrollment period is now closed, so I cannot give anybody else individual health insurance until November 15th when it reopens, the open enrollment period. And the reason they do that is they want the health insurance companies, since there is no pre-existing, they don't want to say, they don't want anybody jumping on the health insurance. Let's say a group had a renewal date of March 1st, and 10 people enrolled and 5 says, no, I don't want it. Well, one of those people who didn't want it in April finds out they have cancer, and now they want it all of a sudden. Oh, no, Mr. Employer, sign me up. They're not going to let them come on now because of that reason. So now they have open enrollment periods for individuals. So the only thing they're doing is if someone signed up on the exchange, they started their process before March 31st and they had problems, they'll extend it to April 15th for those people because, as you've heard, there's been a lot of problems with people going on the exchange website to try to get coverage, but it's been quite a mess. Individual and small group, now they categorize the plans by metal levels. You have platinum plans, gold plans, silver plans. You'll hear these terms thrown out there. Bronze plans. EHB, or essential health benefits, I'll go over those in a minute. And the plans have to be qualified now. One of the things that's going on, and this is where I can sit down with the group, if they were on a plan last year that they liked, when this whole thing started, Obama said, if you like your plan, you can keep it. Well, then he changed their mind and they were going to make people get rid of their plans. And there was such an uproar that now they're allowing people to keep those plans for a couple more years, I'm told. So that changes daily too. So the landscape is changing all the time. We really have to keep up with what's taking place out there with it. Small group only, they have a maximum deductible for $2,000 for a single, $4,000 for a family. In 2015, it gets bumped up a little bit. And they've capped, the maximum is now a 90-day waiting period for an employer. If you have a new employee that's hired on, they used to have waiting periods of 6 months, some of the carriers would allow. Now the maximum is 90 days. After that 90 days is up, that's their waiting period. If the employer deems that this is going to be a good employee that they're going to keep, they must offer them health insurance at that time. Some changes that happen in individual. They now allow child-only enrollment again on the marketplace. They got rid of those plans. They didn't allow child-only for a couple of years ago, but now they brought that back. And now individual, most carriers got rid of maternity a couple of years ago, but now they brought that back. That's part of the essential benefits, the EHB. These are some of the essential health benefits that are now built into the plan. Some people like them because some of them are good, but on the other hand, I know there's people who say, you know, why am I paying for maternity care? Why am I paying for child dental? I don't use it. Faith? Yes? She's told me that many a time, and I said, I agree with you. But there's a lot of things that are built into the plans now up there. Emergency services, hospitalization, maternity care, mental health, prescription drugs, pediatric services. Now the plans have to have dental and vision plans. It's all good stuff, but what is it doing to the cost of our plans? It's driving it up. And a lot of us may not need some of these that are in there. It's not an a la carte service where you can say, I want this, I want that, I want that. You can't have that. It's built into the plans. It's all or none now. That's the way these plans come. So it is what it is. These are some of the metal coverages that I talked about. The platinum, the gold, the silver. What that means is the plan pays on a platinum 90%, the patient pays 10%. It's not a measure of what a plan will actually pay for a single individual. It's a theory that they use that the metal level uses an actuarial value as applied. Like, so if 100,000 people bought the same silver plan, the insurer would pay about 70% of the total cost of the claim. So they now have different plans on, with these bronze levels. You'll see all these. What is a silver plan? What is this? It has to do with the amount that the plan is actually going to pay in the end. If it's an average, really, is what it is. How is guaranteed the underwriting changing for all markets? Like I talked about, guaranteed issue, guaranteed renewability. They cannot turn anybody away on an individual basis. Group, they never could turn somebody away. They had to take you. No more minimum participation requirements. No pre-existing condition exclusions. And like I talked about, the 90-day waiting period for groups. The coverage is effective on the effective date or on or before the 91st day. They have to have coverage. They have to be offered coverage. There's penalties if you don't have health insurance. Starting next year, when you see your tax advisor, if someone does not have health insurance, there's going to be penalties. For 2014, it's a flat dollar amount, whichever is greater, $95 or 1% of your taxable household income. And as you can see, 2015, that increases to 2%. It's the greater thereof. It's going to be the bottom, most likely in all cases. And in 2016, it goes to 2.5%. After that, I don't know what's going to take place yet. Things, like I said, are changing all the time, but as it stands now, these are going to be the penalties somebody has to pay if they don't have health insurance. A lot of people said, you know what, I'll pay it. It's cheaper for me to pay the penalty and then to actually pay the cost of of the health insurance. So what am I looking to meet? I would want to meet those businesses who have 4 or more employees, who currently have health insurance. I'd like to go in, sit down, do a review of their current plan to see if I can make any improvements on what they have. That's the way I do business. If I can't, I'm going to tell them, look, where you're at is good, stay put. I'd like to meet with you again at your renewal next year. But I'd like to go in and talk to them, because there's a lot of confusion about on the marketplace, off the marketplace, does my employees qualify for a subsidy? One of the things with subsidies, real quick, is people think, oh, I'm going to leave the health insurance and go get a subsidy. If they are offered coverage through their employer, they do not qualify for a subsidy. And a lot of people, when they go on this website, they're seeing that, oh, my rate's $300, I'm getting a subsidy, and they'll go ahead and apply. Well, when it comes back, that's not their true rate. They're going to get another rate because they do not qualify for that subsidy. So there's a lot of confusion. Next year, it's going to be a real mess when it comes to tax time for those people. Again, Jason Swartzwelder with Resource Benefits, your research for? Yes, question.
Would you be interested in meeting individuals who currently are covered under Coventry and now have to switch to Aetna?
Yes.
Okay.
Sure. They might not even know that change is
that it's happening.
Right.
Okay, because I have at least 2 clients I can think of right off the top of my head.
Okay.
Right after that.
Yeah, I thought it was interesting how the penalty, 1%, 2%, 2.5%, it said household, total household income.
That's correct.
Now, if my spouse or other people in my household have health insurance and I don't, is it still off that household income of them, or how is that calculated?
I think it is.
I think it is too.
Wow.
And don't forget children.
That's going to be a question for Amber
And
Tax.
every child has to be covered. So divorce attorneys, when they're writing up those divorce agreements, they better put down in writing who is responsible to have coverage for that child. Because children have to be covered, or else there'll be a penalty involved.
But is it who's on your tax return in that household, or everyone living in that household? Because I was told the opposite for that.
She would know better on that than I would. But the employers now have to report on your W-2s what was paid towards your health insurance. It's going to be at the bottom. There's a new line, so they know if you have it or not.
I'm Jason. Jason and he Resource Benefits actually takes care of the Spider Networks employees and does all of our little benefits for health insurance. But his company not only jumps in and takes care of you when you initially need the product, he gets you the best. He looks at all of your, whatever. He compares rates for all the insurance companies and then finds the best fit for your company. But he also monitors you on a regular basis, because I know as a business owner, you tend to get very busy and forget to pay something. And Jason will call you and say, hey, you have to pay your health insurance. Otherwise, your employers are going to be very upset with you. So he takes care of you on a regular basis. He's not the kind of company that just gets you in, forgets about you. He continues to look after you even after the sale. So he's a great referral, and when you refer somebody like him, it also helps you because you're referring somebody who's very reliable.
Thank you.